everybody. This is Julie Edwards. It's a rainy night in Chattanooga. Are you sick of the rain? Are you frowning? Do you want to smile? Then this is your show, because Dr. Nick Circolone is here tonight from Apple Physical Medicine and Rehabilitation. We had to have an arm wrestle to see who got to start the show, me or you.
I don't care. You sound much better when you do it.
No, I just wanted to have the fun of introducing you. Are you having a good night?
I always have a good night. You got to be up. You got to be positive. I love being here. This is just like jazzes me up.
Yeah, but you love being here anyway, Nick. But this is a great time for us to be talking, because the next few months at your practice are going to be different than your patients have ever seen before. Y'all are really bringing in some new treatments to Chattanooga that you've got to be very excited about.
We are. Some of the treatments that we're doing are already being done, but we just put a really cool twist to a lot of them. A lot of the research, a lot of people have been talking about OA, and we're going to be doing OA injections. We're going to do everything from hyaluronic acid. People have heard it and known it as Synvisc or Monovisc. There's Suparts as well. We're going to be doing those. We're also going to be doing stem cell and plasma-rich PRP, plasma-rich protein injections as well, to help with revitalizing and bringing back the knees the way they're supposed to be. The thing that we're doing that's so different than everybody else is we're going to be doing them under fluoroscopy. So you're going to come into the office. We're going to look at your knee, your shoulder, your hip. We're going to be able to do the injections because we're going to be able to see where that medication is going, which is going to make a huge difference, because a lot of times now they're done blindly. They're just kind of, you palpate, give the injection, and there it goes. This way we're going to be able to see it. And the research is showing more and more that you want to be able to know where that medication is going to go, and the only way to do that is through fluoroscopy.
Okay, let's go back a little bit, because this is
We got to move forward. No.
This is what you live and deal with every day. So you speak a vocabulary that some people listening tonight might not know. So let's go back to the knee pain and the PRP injections. Tell me if I'm right. That's designed for people who maybe might be on the brink of needing a knee replacement surgery. This can get in there and cause a regrowth. It
does. And, when you're really far gone, then we want to talk about stem cells. The problem with both those procedures is that the insurance does not cover them. So we're stepping back and we're doing the old-fashioned, the hyaluronic injections, which do help. But see, we're not only doing them under fluoroscopy, but we're adding PT to it. We're adding bracing to it. We have specially designed braces that once we give the injection, it decompresses the knee, allowing the medication to sit and actually start working better in the knee, rather than just doing the injection and then saying, okay, we're done. We'll do a couple of injections. They didn't work. Let's get a knee replacement. That's not what we're doing.
So how do you decide when somebody comes in? We'll just keep talking about the knees for a minute. When somebody comes into the office, what's the first thing you do? I think you're a great listener. So do you ask more questions, or do you talk a lot, or do you listen first?
It's funny. This is not out of my wheelhouse. So when you come into the office with my postgraduate degree in orthopedics, I'm already looking at joints all the time. So you'll come in and you'll tell me exactly what's going on. What happened? How long have you had it? When did this start? Did you have an injury? Did you not have an injury? A lot of times what will happen is you have degenerative knee problems that you already know you have. It's not something that you go, I got a knee pain. I think it's arthritis. You'll already know this before you come to see me. Mm-hmm. What we do is not only are we able to do manipulations on that knee, but now we're able to add the medications to that knee, which is going to help not only get the knee back to where it needs to be, but hopefully getting it to function properly. See, that's the beauty about what we do. Not only are we just doing medicine for it, or not only are we doing chiropractic for it, we're doing everything right there in the office. So now you have a greater chance of things and getting positive outcomes.
Okay, you talk about a we. It's not just you in the office. Who is your team? Do each of you bring to it your own perspective?
There's more to the team now. I was thinking about it on the way over here. I was thinking about the Blues Brothers. We're getting a band back together. What's happening is Dr. Soldo is joining me. Minton Reed, he's going to be our nurse practitioner, myself, we're looking right now for a physical therapist to come in with us. And what we're going to do is we're all going to work together. And now there's a company that that's helped partner with us called IPS. And what they're doing is they're integrated practice solutions. They're helping us get all of this together and in one lump, in one nice shell. Before, when I did it, when we had, the nurse practitioner, we had Julie there and Dr. Dooley there, we were kind of separate, but we were the same. This time, we're together as one group.
So that you're sort of conferencing with each other, and that way your patients, when they come in, are getting almost like a Walmart supercenter. I mean, everything under one roof, and they don't have to waste their time driving from one person to another. They get it all.
Exactly.
While they're there.
And there's other things that we're going to do. There's preventive medicine exams and preventive testing that we can do. There's a lot of things that are out there that we want to bring into the office to offer to our patients. But here's what's really great about this. Whatever information we gather on you as a patient, now we give to you, and you can take to your family doctor so they can do a better job and knowing exactly what's going on with you. Now, basically their book on you has expanded exponentially. The cool part about all of this is that we're working as a team, and that's the best way to do it. Multidisciplinary practices are the way of the future. What we're doing here, we're not the only multidisciplinary practice, but I want us to be the premier. And by doing that, it took me a long time. We've been talking about this since last year, Julie.
I know.
So now what we're doing is we're now getting ready, and the kickoff is in May. So now we're starting to talk about it. I know at the break we're going to have somebody come on, and we're going to be talking about something that's so cool and so wonderful for pain control. Now, a lot of people deal with pain with knees, they deal with shoulders, they deal with other kind of pain issues. But we're going to have a guy come on in a little bit, and we're going to talk about something else that we're going to be introducing that's kind of blows away all this other stuff, even though this other stuff is awesome.
Okay, that's an awesome tease 2 minutes before a commercial. Well, you tease it again in a second, but I want to go to something you said a minute ago, which is that you give your patients then kind of this file, if you will, that they take with them to their primary care doctor. You are not in any way trying to suggest that you would replace a medical doctor in a patient's life. You are there to help be part of a solution, not the only.
No, we cannot do that. I am a musculoskeletal physician. That's my job. But if I can add more things to build that patient file so that other doctors, including their primary care physician, can make better judgment calls, that's what we're trying to do. I mean, that's just the way it is. We're looking for preventive, not for something that we're going to be able to, we want you as a patient. You're going to leave your family doctor. We're going to take care of everything. That's not what we're doing. That's not what we've been about.
No, but I think most folks now have a much better understanding of what all you can do in the chiropractic world. But there is still sometimes some skepticism that some people have, and I was just wanting to put that at bay so that people could know, no, you're just part of the solution, not the only one. So Nick's been talking about the numbers of people that they can help. Let me give you a number, 267-1023. That's the phone number into the studio. You can have a chance to have Nick help you with any pain question that you may have. Listen in, though, when our caller calls in a minute. Hear his story. That might trigger you with even more questions. We're back. Are we going to call this Health Chat?
Of course, it's always Health Chat.
We're back with Health Chat when we come back.
Sometimes I feel I've got to. We can dance if we want to. We can leave your friends behind.
Welcome back to Health Chat. Nick and I are here. I tell you what, he is dancing in the studio tonight.
I can't help it.
You are... Okay. I didn't quite know why he was so excited, but when he and I saw each other before the show started tonight, he said, Julie, you're not going to believe this. You've been hatching these new avenues for growth at the office for a while.
Oh, yeah, we have.
I knew good things were coming your way, but this is my first time to see you since Thanksgiving time or earlier.
It's been that long?
It's been a while since I've seen you. So this is exciting. We've got a caller on the phone, your friend Mark. And I'm going to be quiet and let you do the introductions. And I've got some questions for him, too. But if you're out there listening and you have pain, of any kind, you know someone who has pain of any kind, do not turn the dial. Just keep listening.
Yeah, you have to. Mark,
Nick.
how's it going, buddy?
Doc, how are you, sir? I appreciate you having me on tonight.
Oh, listen, I'm so happy. I'm going to plots right here, man. I'm just having so much fun. Miss Julie's with me.
Hey, Mark.
We just love.
Hey, Julie.
I just love doing this. Mark, I've been so excited ever since Ty talked to me about this and introduced me to you. And I'm just going to give you like a 2-minute explain what the Stivax unit does. Give it to me in a nutshell.
In a nutshell, my elevator pitch. Well, to be up front with you, Doc, we're out here changing lives. That's what we're doing with the main thing. Regardless of what news channel you select, we can see that the opiate crisis is a travesty going on in America. We're dealing with a lot of folks out there with insurmountable amounts of pain, and they don't really have a lot of places to go. Enter Stivax. That's what we have, the neurostimulator. What this device is it provides non-narcotic pain relief for folks suffering from chronic pain, migraines, or other opiate issues. This device is changing lives all over the country. We launched the device about 2 years ago stateside, and have been burning a trail since, out there serving the community, helping people, being able to get off of opiates, being able to lead a more healthy life, getting their life back, and being able to enjoy everything that they did before all the pain came through by creating the pain relief that is not opiate-based.
Hey, Mark.
So we're very excited to be a part of it.
Can I ask you a couple of questions?
Yeah, sure.
Okay,
Absolutely.
so you have mentioned a couple of times how it's been stateside now for 2 years. So was it tested and has it been used in Europe or other parts of the world for a while?
It sure has, Julie. Folks in the show can look at the other device. It's called a Ducast, and that's just German for Stivax. And we were overseas launching it about 5 years ago, 5.5 years ago, I guess it was, throughout Europe, Germany, and Austria before we came to the United States.
So Nick was explaining to me a little bit in the commercial about how this works. This is a tiny little device that goes in your ear. Is that right?
Correct. So the external stimulator pack is placed on the patient's shoulder, just above the clavicle. There's one small wire that comes out the side of it, and we have two tiny needle arrays. And those needle arrays are going to be implanted directly into the patient's ear in a specific part. And the medical side of it is by creating a small level of electrical current into that ear, we are going to be able to create something called an endorphin release, which is going to be spread throughout the entire body. What Doc can explain further on that if you'd like, but essentially what we're doing is by creating the endorphin release, we're leading to the non-narcotic pain relief this device is known for.
Because that's why the opioid crisis is so bad, right? You love the feel of those endorphins. You got to get it somewhere.
Well, one of the beauty parts about this is, from some of the stuff that I've been reading, and correct me if I'm wrong on this, Mark, it's an acupuncture meridian point in that ear that helps deal with some of this. There's actually a technique, I don't know if you knew this, Mark, where they're using acupuncture needles to try to get the same result as we are with the Stivax unit, but they're not able to stimulate that area like we will with the unit, which has been fantastic in my thoughts. I have to tell you, I've been so excited about this. I've been just nonchalantly talking about it, and patients are like, when are you going to put it in me? It's just one of those things where it's going to perpetuate itself because people are in pain and they don't want to be.
But think about what that's going to do, too, for the depression problem in this country. I mean, this is the ripple effect of doing away with pain is vast.
It's going to be... It's going to be life-changing, as Mark said. Mark, one of the things that kind of sold me on this, and I'm just going to be honest with you, being a doctor, I get a lot of people pitching me stuff. I'm just going to be honest with you. And they pitch it to me, and they go, I was the first in Chattanooga, first chiropractor. I don't know if it was the first medical, first doctor, because Dr. Bill Moore-Smith and myself, we started doing decompression therapy in Chattanooga, okay? I was told... This is the latest and greatest. It's FDA approved, but the insurance companies won't pay for it. Now, when I heard about the Stivax unit, they're telling me, oh, it's FDA approved. It does all of this. That's great. But how are my patients going to pay for this unit? And when Mark and I started talking, correct me if I'm wrong again, Mark, but insurance companies pay for this product. Am I correct?
Absolutely. Absolutely. A lot of offices will utilize the device in various forms, whether it's a cash-based service or an insurance-based service. So the listeners out there will need to check their local insurance policies and work with their doctors to be able to work with their billing companies to see if there is coverage in their area. I've been able to see it with insurance coverage. I've also been able to see cash as an option as well for folks who do not have insurance or for offices who are cash-based. So there's several different ways to be able to provide this therapy for patients. Absolutely.
Well, in our office, and this is what I'm going to say, in our office, we will be taking your insurance. One of the things is that our doctor, Dr. Soldo, will be implanting the units. And when I say implanting, a lot of people are going, wait a minute, this is it's really not as bad as it sounds. And Mark, again, the way I've been describing it to people is it's like a thumbtack, but it's not really a thumbtack, that's slightly inserted into the skin of the ear. Am I correct in saying that?
Absolutely.
Yeah.
When you're looking at the size of the needles here and the needle arrays, if the listeners are at home, they can kind of look at the tip of their finger. The length of the needle is 1/8 of an inch long. And in the medical world, for all you listeners, they measure the diameter of a needle in a number. The bigger the number, the smaller the hole, if you will. So most earrings are pierced at a 20 gauge. Okay, just to kind of give you an idea. The Stivax neurostimulator has a 38 gauge diameter on the needle. So we're talking very, very small, 1/8 of an inch long. So when we talk about needles being implanted into an ear, most folks go, oh gosh, that sounds super, super painful. I'm proof by seeing it thousands of times now that it's simply not. It is a very, very quick procedure done in about 10 to 15 minutes. Other than the prick of the needle that goes into the ear, most patients do not feel a thing.
Since you have seen so many of these procedures, Mark, can you talk a little bit about what you see in the results? How quickly do the results begin to show up? And what kind of life-changing events have you witnessed?
Well, just last week I was in North Carolina. We worked with a patient who had chronic back pain, lower back pain, for over 30 years. And this young lady could not even sit down because she was in so much pain without having a pad under her bottom. And we utilized the device, and we were going through the entire training with her. And by the end of the training, that was probably maybe 30 minutes or so, she actually stood up for the first time and sat back down on the treatment table without a pad under her rear for the first time in 30 years, and the lady actually began to cry because she was so happy of just that basic breakthrough that so many folks who do not suffer from that type of pain just take for granted to sit down in a chair. Well, she could not. That was too painful for her. So being able to do that within 30 minutes of the application of the device was something very moving to see in person.
And would the expectation be that if that happened after just 30 minutes, over the course of days and weeks, her mobility would get even better?
Absolutely, and I just spoke to that provider earlier today on an unrelated note, and asked them about that particular patient, and they said that the device has now been on, just finished up her first device, so it was on for 2 weeks, and said that she's feeling better now than she has in years, and she can't wait for the follow-up devices.
Okay, so how does that work? I was going to go there, too. So when you have one implanted, does it last for only a couple of weeks, like you're saying, or does that patch on your shoulder get replaced?
Well, what happens is, I'm going to take this one, Mark, for a second. See, and correct me if I'm wrong again. This is I'm trying to get this in my wheelhouse. So, you're the man. But what we're doing is the FDA has approved 3 units. Each unit lasts about 2 weeks. Correct on saying that, Mark?
Correct.
Okay, and what happens is they're replaced, and after that, they're removed. Now, after they're removed, what we're looking at is and we've been conservative. Mark and I talked about this. We're going to be conservative about this. We're looking at least a 50% improvement in overall pain. 50% improvement in a woman that he just talked about is huge. So when you're dealing with pain on a chronic basis and you have 50% relief, are you going to get more? You can get more, yes. But we're saying 50%. So if you get that 50% relief, what's going to happen is your life has changed. And that's what this unit's going to do. And that's what made me so excited after talking to Mark, that I'm going to be able to change people's lives in the Chattanooga area. And with the help of Stivax and Mark and some of the other people, we're going to be able to bring this into other areas and be able to change the way people are living today.
Mark, can you hang on the line? We got to hit a commercial break.
Sure, not a problem.
Hang tight. And if y'all want to call and join the conversation, maybe you're listening, you have a question for Mark or Dr. Circalone, feel free to call in 267-1023. More with Health Chat and this Stivax unit when we come back. Welcome back to the show, everybody. Julie Edwards, along with Dr. Nick Circalone from Apple Physical Medicine and Rehabilitation. His friend, Mark, who is representing a great new device called the Stivax unit, new to us, 2 years in the States, talking about this really life-changing procedure that is not only FDA approved, but by most insurance companies it is approved. Going into the commercial break, I invited folks to call in. Lisa has done that very thing. So if y'all are okay, let's take her call and see what she thinks. Hey, Lisa.
Absolutely.
Thanks
Hey, Lisa.
for joining the show.
Hey, how are you? Thank you. How are you?
Fine, thanks.
Two questions.
Sure.
Is this device effective with chronic migraine disease? And I'm wondering if it would improve pain with a herniated disc, specifically the L5S1 disc.
Two things. I will tell you from the research, yes, for the migraines. Now, when we're looking at pain from a herniated disc, that's a little bit more intense. It depends on what the disc looks like. It depends on how the disc is. It depends on where it's touching. It depends on what therapies you've had prior to it. There's a whole myriad of things that we can go into. But if it's one of these things where somebody has a disc bulge that creates inflammation, a kind of a chronic inflammation, and they're taking an opioid to get rid of the pain, not so much an anti-inflammatory, yes, I think this unit would work. But again, that's on an individual basis, to be perfectly honest with you, Lisa. And I think Mark will agree with me. Won't you on that, Mark?
Absolutely. Absolutely.
You know, because what we're looking at is chronic pain. If a structural problem is something that can be fixed, we may want to have it fixed, or other procedures done before we would try pain control with it. Does that help?
Yeah, that helps tremendously.
Yeah, and how long is it you personally that has had this?
No, my daughter has it. She's 22, no trauma. She had an MRI that revealed a herniated disc L5S1. The neurologist or the radiologist described it as a large herniation in the writing, and it shows it looks like a little mushroom coming out of the space on the slice of the MRI. And she's had cortisone. It was ineffective. She's done physical therapy. It was ineffective. She's in pain. Her feet tingle. Wow. I mean, off and on all day long. And she's 22. So that's like, whoa, time out. What's going on here?
I will tell you this. I'll tell you this. Where did she have the imaging done?
Here in town.
Do you remember the facility?
Lydia, what was the facility where you had your MRI? Chattanooga Imaging, I think.
Okay. I will tell you this, Lisa. Take my number down, all right? It's 855-7376.
Okay. Are you guys up there on Shallowford Road?
Yes, ma'am.
Okay, I've been there before. Okay.
Oh, you've been to my office?
Yes, I have been to your office.
Okay.
It's been several years ago, but yes, I have, with my husband.
I will tell you this. Hopefully it was a good experience.
It was. Thank you. It was very much.
What you could do is, I am not going to be in town next week, but I will tell you this. Call the office next week, get a hold of Shay, give her all the information, tell her where it was, and I will personally look at those films for you and call you and let you know what I think. How's that?
Okay, that would be awesome.
Her name
is
Shay.
That would be absolutely awesome. Yes.
Okay.
I will do that.
Yeah, and just to let you know, and everybody else listening out there, Nick and I were talking a bit in the commercial. I had misunderstood when you and Mark were saying that with this device, this Stivax unit, that you can get it, or you get it up to 3 times. I thought it meant if the first 2 weeks didn't work and you needed more, you could get it again. That's not the case.
No.
The way it's approved, you need to get all 3.
Yes. Yeah.
Okay.
The protocol procedure is 3 units. So
Okay.
that's what FDA. That's when and correct me if I'm wrong. Again, I keep saying that, Mark, but it's 3. You have to use the unit 3 times. That's the FDA protocol, correct?
Correct. Yes.
Yeah. So that's how it was designed. That's its intended use. And for the insurance company to pay for it, frankly, you have to do it exactly the way they said to do it.
Okay, awesome.
I hope your daughter
Well,
gets better.
We do too. We do too. I mean, for being 22 with everything ahead of you, it's like, wow, I got to put the brakes on now. This is kind of out of order.
Yeah.
So, thank you, and we will definitely do a follow-up with
Okay.
you guys. Thank you so much.
Happy Easter.
Yes, happy Easter. I may not be able to help her, but you know what? I can put her in the right direction.
But you know what I hear is that this gives you one more really credible path to go down to help people. It's a terrible thing to have a patient come and there's nothing you can offer them. At least this gives you something that you haven't had before.
Right. This is so new and exciting that, like I said, I get jazzed up about it. And Mark, I don't think you can tell that I'm excited, can you?
I hear it in your voice, Doc, and it's outstanding to hear because I've been on the street now for almost 2 years, and I go in there and I continue to see with this device how much we're changing people's lives, how much we're giving people's lives back. I think that would be the big thing that I see on a reoccurring theme is that folks just want to go and do the basic items, go and smell the roses, so to speak, or play with the dog, or play with the grandkids and what have you, and utilization of the Stivax device along with other medical therapies. We're continuing to provide that. So every time I go into an office. I'm coast to coast. Today I'm in Georgia. Last night I was in Florida, working with folks all the time, trying to spread the word about this device and just really give people's lives back.
Let me ask you one last question. Then, if Nick wants to keep it going, that's fine by me. But with the way this works again is you put this patch on a shoulder, and the Stivax unit itself goes into your ear.
Clips into the patch.
Okay, for 2 weeks. Then at the end of those 2 weeks, you said that you move it, preferably to the other side. And then for 2 weeks. In the third 2 weeks, it goes somewhere else, like at the back of your head?
No, it's the same ear.
The same ear. But the idea then being that at the end of those now 6 weeks, all of this endorphin alteration, I guess, right, is in your body, and now your body can do what it needs to do. It just wasn't equipped before. Is that kind of it?
That's it. You're spot on there. I'm sure Doc and I could go into further detail, but for tonight's discussion, yes. Essentially, what there are in your body, and Doc, please chime in when you're ready, is the ability to trigger the endorphins, kind of your natural pain fighting ability, and being able to trigger that throughout your body is what the Stivax aids in doing, which is really what we lean on with the non-narcotic pain relief. So that's essentially what we're trying to do for tonight's discussion, is to be able to trigger that natural pain-fighting ability to give patients their lives back without the usage of heavy-duty narcotics.
You had mentioned the name of this in German. For folks who are listening, if they wanted to look this up, is there a website to go to, and can you spell out Stivax for us?
Absolutely. So all the listeners are at home, if they're looking to find some further information, you can go to Stivax, spelled STIVAX.US. So Stivax.us is our United States website. They'll be able to click around and find several different images of the device. And then if they would like some further information, Dr. Nick was nice enough to give his number to the previous caller. Feel free to give his office a call, as he's going to be our anchor in the Chattanooga area to be able to bring this device to the forefront for that part of Tennessee.
Very exciting.
We're excited, Mark. Mark, thank you so much for coming on. We're going to be talking a little bit, and I'll call you later on, and we'll discuss some other things. I'm looking forward for you coming in next month, or actually 1st of May, and so we can get all of this started. So you have a great day. Enjoy your holiday, my friend, and I'll talk to you in a little bit.
Thanks, guys. Have a great night. I appreciate your time.
Thank you,
Thank
Mark.
you.
What a great job he has.
Isn't it cool?
Yeah.
So Now do you see why I'm so excited?
I do indeed. I do
like,
indeed.
This is like, come on, let's get it on. Let's get people to get it in.
So I want to pick up on what Lisa had asked about migraines. When we come back, let's catch our last commercial.
Sure.
And we'll talk about that a little bit. Also allergies, because the pollen count is crazy high.
We're not talking about allergies today. That's somebody else.
I know, but can't you help with allergies? Does chiropractic ever help with allergies?
We can, but there's a whole scientific. We don't have enough time. Yeah, we'll talk about it when we get back.
Right after this.
Now in the street there is violence, and none allows.
I don't care what they say, Nick. The 80s was a good decade for music. I like it.
I need to put a picture of me in the 80s. I have a picture, no joke. People that put pictures on Facebook need to have a release from the person that's in the picture with them.
Yeah.
I have a friend
That would be a good law.
I have a friend. I call it Guido and the Princess. All right. I look like something from Miami Vice, and if you look really, really close,
Yeah.
there's a cigarette in my hand.
Oh, Nick.
Yeah, it was bad. I was a bad kid.
Well, that was the times, I guess.
It was. I had a fedora on. Everything was pretty.
Okay, so educate me. I know that we can't go to medical school in 12 minutes. However, you can help with problems with allergies. Sort of.
It all depends. And I'm going to be really quick kind of what this is. A lot of times when you have an allergy, if you have like anaphylactic kind of allergies, like for peanuts and things, we're not talking about that. But when the spine is aligned, the body is in homeostasis. So it's functioning at optimal levels. If you can keep the body functioning in optimal levels, the chances of allergies in some people is or the allergies in them sometimes is reduced. Now, when we look at a lot of people, like, oh, my sinuses are clogged up, my ears are clogged up, then what happens is with an adjustment or manipulation, what happens is we work on the extrinsic muscles of the body, the extrinsic, the ones you can control. And then you have intrinsic muscles, which you can't control, which are like around your eustachian tubes and in the orifices that control the the muscles that control the orifices in the sinuses. Once people get adjusted, they go, oh, my sinuses are clearing up. What's happening is we've indirectly or directly affected them by adjusting muscles that were extrinsic, and we affected intrinsic muscles, allowing the sinuses to drain, the ears to drain. Now, if there's infection in there and it's not able to be taken care of with normal, everyday, over-the-counter kind of medications, if there's an infection that ensues, then of course you're going to need some different medications. Some people think that's blasphemy when I say that, but we work. I'm a team player. Mm-hmm. We work as a team with other doctors. I am not the end all be all, but it's if I can help you feel better, I'm going to help you feel better.
Right.
If they can help you feel better, they're going to help you feel better. And we need to work as a team. And that's always been my philosophy ever since I've been here for 25 years. Mm-hmm. Is I want to work with my medical counterparts, my physical therapy counterparts, and any other healthcare providers that we can benefit our patients. That's all. It's what it's all about.
Sure, because sticking with the allergy part of the conversation, if you are going to get allergy shots, which could benefit you over the course of a lifetime, but it takes a while to build up, while it's building up, they can come to you for some immediate relief, possibly.
Musculoskeletal disease or musculoskeletal irritations can affect the body in many ways. It can affect GI, your digestive system, okay? It can help with GERD in some instances. These are things that are not like, oh, yeah, this is proven, we have double-blind placebo studies. You can't really have that. But there is effects for these things if it's related to the nerve pathways. See, that's the thing. When we have nerve pathways that are being interfered, if we can get a conjunction and find out that that's causing a problem, we know that that's going to be affected. Prime example. When Lisa was talking about her daughter's having pain down her legs.
Yeah.
That nerve that's affecting the nerves going down her leg also can affect the urogenital area where it can affect female issues, bladder issues, kidney issues. So, there's one thing called, I almost forgot. If you have a disc bulge, okay, it's called Cauda equina syndrome. If a disc is so bad, you will lose bowel function. That is an emergency surgery situation. So if what I'm saying is, oh, no, it doesn't affect my internal organs by having a bulging disc, Yeah, it does. Because if it's so bad and you lose bowel function, bladder and bowel function, and it's a surgical intervention, that's easy to figure out. It's affecting those things. So that's the way we look at chiropractic. We're looking at how structurally is this going to affect the body.
What about the fact that the way we live now structurally affects the body? You know, I've heard you say before that sitting is the new smoking.
Like I'm sitting right now, right?
Well, no, Nick stands up. I'm sitting right now. I just did sit down, though, a couple of minutes ago. My Birkenstock feet got tired. But what happens when we sit at work all day, especially if you have your legs crossed? You just get totally misformed.
It messes with the biomechanics. So here's the thing: when you think about posture, when we look at our computers, you know, we have a posture when we do that. We have a posture of how we read a book. We have a posture of how we work on our computer. We have a posture as we sit. We have a posture as we stand, as we function in our daily activities. But that all affects that area as well. But what other people don't realize is what we put in our bodies, what our body's exposed to, all of these affect that. So it's not just one thing. So when we talk about this before, when you come into my office, I'm asking these questions because I need to know what is really affecting you. Then when you talk about allergies, well, you have somebody that works in a garage and they're smelling in carbon monoxide fumes all the time. That's going to trigger other things as well.
Sure.
Not only is it going to be bad for your lungs, but it's going to trigger things in your body. So we have to look and find out where the problem is so we can fix it.
Okay, back to Stivax for a minute.
Now you're just jumping around.
I'm
getting dizzy.
It's designed to help with chronic pain. Do people sometimes get so used to living in pain that they don't know they don't have to? So are there some people who this could benefit, but the trick is first to let them remember that they're not living their optimal best?
It works all the time. 9 times out of 10, you know when you have pain.
Sure.
You know it's chronic and you live with it. You know, it's not stopping you from what you're doing, but it is stopping you from doing what you want to do the way you want to do it. So that's the difference. If you're playing with your grandkids and you're sitting down and, oh, they're sitting on my lap, this is great, this is wonderful, rather than going out and being with them, this is life-changing. I will tell you this. If I can change your life by 50%, and I keep saying 50%, we get more than that. I do. I've changed people's lives where they're out doing things. Prime example, I have a woman, I have 2 patients that came into my office with foot pain. They were in the office. They were wearing braces. They were not living their life. I took the braces off. We examined the foot. We had x-rays taken. We wanted to make sure everything was okay. There was nothing structurally wrong with that foot or that ankle that would cause them to have to wear a brace all the time. We changed that. We gave them exercises. We put them into an orthotic. They're now getting ready to do activities that they never thought they would do again.
So wait a minute. Why were they wearing the brace to begin with?
Because their doctor said you need to wear this brace because you have a weakness in this area, and by wearing the brace, this is going to help you.
Oh, I see.
Be able to do the things you want to do. Instead of going and rehabbing this, they were wearing braces. Not saying the doctor was wrong. You know, I always, when people say, well, my doctor told me to wear this brace 24/7. Really? Maybe that's what you heard, but that's not probably what they said. So when they come into the office, we're able to change some of these things and get people back. That's why I'm so excited that we're going to have this larger group now working as one unit. See, we're working as one unit, not separate units, working as one unit to benefit our patients.
I know that the Stivax won't launch until May, right? Do I have that right?
Yes, but you can still call me and we can get you set up.
That's what I wanted to ask you. So is it a good idea for folks to come in and just have you kind of assess them and see if, because you're not going to just all of a sudden make that the fix for everybody.
No, we need to find out what's going on. I need to get a baseline. So, you know, if you say, I want to come in and I want to talk to Dr. Circolone about the Stivax unit, we'll set up a special appointment, which is going to be longer than most appointments because I'm going to sit down and talk to you. You know, I'm going to have you fill out pain forms. See, here's the thing. We need a quantitative assessment. So you're going to fill out a form day 1, and then when you're done your treatment, you're going to fill out a form again. And you'll turn around, I had no relief. And then I'll show, well, yes, you did. Look at what you wrote here and look what you wrote here. So we'll be able to show you how much better you have actually gotten.
Have you witnessed it going into anybody? Like Mark mentioned how he saw the lady in North Carolina.
No, but I've talked to people about it.
And do they tell you similar stories?
Yes, I've talked to the providers about it. So what's happening is they're seeing a variant of things. Some people great, great, great. Some people not so great. It's not everybody's going to get perfect. Mm-hmm. But you know what? When the higher percentage is perfect, that's good.
And if your insurance company is covering it, why would you not want to give it a try?
Yeah. And now, when we say this, your insurance company will cover it, but people are still responsible for somewhat of a cost.
Well, sure. Whatever your deductible might be or your copay.
Absolutely.
Right.
Here's what sold me on it. I will tell you this is the last thing before we go off the air. When somebody told me that the insurance company covered it, I thought, okay, Medicare is one of the biggest ones that covers it. When Medicare covers it, they've done their research. They're not going to pay for something that doesn't work. That was my big thing about it, is that the insurance companies were paying for it, especially Medicare.
So it's the doctor in your practice who will be the one to put it in?
Yes, it has to be. It won't. It will not be paid for. I could put it in. That's not a problem. But if we want it paid for, my doctor has to do it.
Okay, so again, if you're picking up on this late, this is called Stivax. The website is Stivax, Stivax.us.
Yes.
You can learn more about it. Nick will be having it at his office, Apple Physical Medicine and Rehabilitation, beginning in May. Back on the radio with us next month. Give him the office number, Nick.
It's 855-7376. Feel free to call and ask any questions.
All right. We'll see you next week. Happy Easter.
Happy Easter, and God bless everybody. It's great. I'm so excited about the future.